Hi there. We are occupational therapy students and faculty at Rush University Medical Center in Chicago, Illinois. We will be presenting on a project we did that focused on training emergency department clinical staff to better recognize and document the presence of intellectual and developmental disabilities among patients, titled Hospital Emergency Department Staff Training for Effective Documentation for Intellectual and Developmental Disabilities. This was an interdisciplinary project, and we worked with nursing students and health systems management students and faculty for this project. We did this because individuals with IDD utilize healthcare services more often than the general population, but they are not always identified within the hospital, which results in reduced quality of care and potentially lost revenue. Most hospital admissions begin in the emergency department, so we targeted our project towards providers in the emergency department. Identification of IDD in the emergency department is complex and involves providers first recognizing a patient has an IDD, then documenting it in the medical record, and hospital coders assigning the correct ICD-10 code. Unidentified individuals with IDD present as a missed revenue opportunity. What we did. For this project, we created an online training curriculum targeted for emergency department staff to identify why, how, and where to document IDD as a secondary diagnosis in the electronic medical record. Training included what IDD is, common signs, importance of identifying IDD, statistics about current IDD identification rate, common IDD diagnoses, and how to document in the medical record. We used pre- and post-training surveys of ED staff to gauge understanding, confidence, and importance of the material. We then analyzed total hospital admissions pre-post training to investigate if the curriculum led to increased documentation of IDD in the ED. A small sample size was available for data analysis, potentially limited by the COVID-19 pandemic. We also analyzed formal billing codes, CPT, and levels of severity, ESI, to identify differences in revenue capture. We found that the majority of emergency department clinical staff reported never having training related to IDD. While there were self-reported improvements in identifying and documenting IDD, overall there was no change in frequency of IDD as a secondary diagnosis when looking at the emergency department admission data. There was a discrepancy between level of severity and formal billing codes, which may translate to missed hospital revenue opportunity. The COVID-19 pandemic likely affected our results. Our recommendation moving forward is to work on training healthcare providers working in the ED and hospital clinical coders to increase knowledge of IDD identification and documentation. Thanks for listening.